Lung cancer is a serious illness. It occurs when cells in the lungs grow uncontrollably. These cells form tumors that can spread to other parts of the body. Lung cancer is a major health concern worldwide. It is one of the most common types of cancer. Lung cancer can affect anyone. However, it is most common in people over the age of 50. Smoking is the leading cause of lung cancer, but there are other risk factors. Early detection and treatment are crucial for improving chances of survival. There are two main types of lung cancer. Non-small cell lung cancer, or NSCLC, is more common and grows slower than small cell lung cancer, or SCLC. Each type behaves differently and requires different treatment approaches. NSCLC includes subtypes like adenocarcinoma, squamous cell carcinoma, and large cell carcinoma. SCLC is more aggressive and often spreads faster. Understanding the type of lung cancer is crucial for effective treatment. Smoking is the primary cause of lung cancer. Cigarette smoke contains harmful chemicals that damage lung cells. This damage can lead to cancer over time. The risk increases with the number of cigarettes smoked and the length of time a person has been smoking. Besides smoking, other factors can increase your risk. Exposure to radon gas, asbestos, and certain chemicals can also cause lung cancer. Family history of lung cancer can also increase your risk. Air pollution is another significant risk factor, especially in urban areas. It's important to be mindful of air quality and take necessary precautions in polluted environments. To reduce your risk, avoid smoking, test your home for radon, and maintain a healthy lifestyle. Lung cancer may not show symptoms in its early stages. However, as the disease progresses, some common signs may appear. These symptoms can also be caused by other conditions. It's important to see a doctor for a proper diagnosis. One of the most common symptoms is a persistent cough that doesn't go away or worsens over time. Other symptoms include coughing up blood, chest pain, shortness of breath, wheezing, and hoarseness. Unexplained weight loss, fatigue, and loss of appetite can also be signs of lung cancer. If you experience any of these symptoms, especially if you are a smoker or have a history of smoking, it's crucial to consult a doctor promptly. Diagnosing lung cancer usually begins with a physical exam and review of your medical history. Your doctor will then recommend imaging tests, such as X-rays or CT scans, to examine your lungs for any abnormalities. If a suspicious area is found, a biopsy may be performed. This involves taking a small sample of tissue from the lungs to examine for cancer cells under a microscope. Treatment for lung cancer depends on several factors, including the type and stage of cancer, your overall health, and your preferences. Treatment options include surgery, chemotherapy, radiation therapy, targeted therapy, and immunotherapy. Surgery is often recommended for early-stage lung cancer. Chemotherapy and radiation therapy are used to kill cancer cells. Targeted therapy uses drugs that specifically target cancer cells, while immunotherapy helps your immune system fight cancer. Each treatment option comes with potential side effects. Surgery may lead to pain and infection, chemotherapy can cause nausea and hair loss, radiation therapy might result in fatigue and skin changes, targeted therapy can cause liver problems, and immunotherapy may lead to flu-like symptoms. Preventing lung cancer involves making healthy lifestyle choices. Quitting smoking is the most effective way to reduce your risk. Avoiding exposure to secondhand smoke is also crucial. Regular exercise and a healthy diet can strengthen your immune system and improve overall health. It's important to avoid exposure to harmful chemicals and pollutants. Regular checkups and screenings can help detect lung cancer early. Vaccinations, such as the flu shot, can also help protect your lungs. By making these changes, you can significantly reduce your risk of developing lung cancer. Living with lung cancer can be challenging, but there are ways to manage the disease and maintain a good quality of life. It's important to follow your treatment plan and attend all medical appointments. Support from family, friends, and support groups can provide emotional and practical help. Managing symptoms and side effects is crucial for maintaining comfort. Palliative care can help improve quality of life by addressing pain and other symptoms. Staying active and engaged in activities you enjoy can boost your mood and overall well-being. Remember, you are not alone, and there are resources available to help you through this journey. Advances in lung cancer research are offering new hope and possibilities for those affected by the disease. Research in lung cancer is continuously evolving, leading to new and improved treatments. Clinical trials play a crucial role in this progress, providing patients with access to cutting-edge therapies that may not yet be available to the general public. One significant advance is in genetic testing, which allows for more personalized treatment plans tailored to the specific genetic makeup of an individual's cancer. Immunotherapy, a treatment that harnesses the body's immune system to fight cancer, has shown great promise in treating certain types of lung cancer, offering new avenues for those who may not have responded to traditional treatments. Researchers are also focusing on early detection methods, which can significantly improve outcomes by identifying lung cancer at a more treatable stage. Ongoing studies aim to better understand the biology of lung cancer, paving the way for the development of more effective treatments, and potentially even cures. Staying informed about the latest research can provide hope and new options for those affected by lung cancer, underscoring the importance of continuous advancements in the field.